All right, I'd like to welcome you all to the Exam 1 review. The exam will be given after the balloon pump class on the 21st of September. I believe we're scheduled to start the exam at 1 p.m. It'll be 100 questions, multiple choice, be taken on a computer. We get instant results, and I can run some analysis, and if there's any problems or anything like that, we can definitely look at it and talk about it. Going over what's going to be on the exam, chapters 1 through 3 that you were to read before class started, talking about introduction and talking about critical care medicine, transport. In there, it kind of talks about what CCT is, why do we have it, what delineates critical care transport as opposed to regular EMS, the rules that are associated with it. Sorry, I had to do a little pause there. Understand the roles of EMTALA and COBRA and how it dictates and affects or necessitates CCT transport. Moving into more of the flight air medical chapter, it talks about the roles and responsibilities of the different players. There's program directors and medical directors and clinical coordinators and that sort of thing. So be familiar with the different roles and responsibilities of the different administrative type persons associated with those types of programs. Moving into airway drugs. All these drugs are ones that you're going to need to know. The dosages and the indications, contraindications, side effects, the onset, the duration, pharmacology, especially when it comes to the depolarizing and non-depolarizing paralytics, SUX versus VEC. I want to make one little clarification that I think the slide was actually incorrect. It has been brought to my attention, and SUX's duration is typically 3 to 5 minutes. I think that the slide that we used in the lecture was longer, in the neighborhood of 8 to 10, but 3 to 5 minutes is the duration for SUX. Of course, really keep it in mind when you contraindications for SUX. Assessing your airway, the Mallampati scale, be familiar with that. How to use the bougie, what you're looking for, the stop or the hold up point to identify that you're hitting the carina, that you're in the trachea. Other methods to assist in being able to establish an airway, mainly the external laryngeal manipulation or burp method. Moving on into surgical crikes, you need to know the procedure inside and out, indications, contraindications, be able to describe the procedure, answer specific questions on that. Ventilation. Okay, we spent a lot of time talking about the different modes of ventilation. SIMV and assist control, pressure support, CPAP. Also understand the pressure versus volume regulated breaths, how one affects the other, how the patient complies with it and the resistance that's met, and understanding how all that stuff kind of comes together and effectively ventilates the patient. You need to have a thorough understanding of how that ventilator works. With that, you need to know what all the normal settings are. Tidal volume is based on ideal body weight. The rates, typically the rate for an adult is 10 to 20. I know I talked about it, sometimes it goes lower than that, but for testing purposes, 10 to 20 is your magic number. FiO2, PEEP, pressure support, understand what the peak inspiratory pressure is, and the IDE ratio, what a normal IDE ratio is, and when you might want to manipulate that to aid in the amount of pressure that's involved in ventilating patients, as well as dealing with those obstructive patients that we talked about. You need to be able to work through blood gases. You need to know all the normal values for blood gases, abnormal values, obviously, and understand the normal stimulation, what stimulates patients to breathe, i.e. is it the CO2 or O2 and all that stuff that you learned back in EMT School 101. Shock, you need to be able to identify the different types of shock based on history and hemodynamic values that you can obtain now, and with that also how to treat. And I think there's some sample questions that really show you have these numbers for this set of values, what is the potential problem with this patient, and then maybe how you would want to treat it. You need to be able to define shock and how the body responds to shock. Go back into your pathophysiology with the Krebs cycle and ATP production and anaerobic versus aerobic metabolism and how lactic acid is produced, and be familiar with that and the effects it has on the body. Medications, you really need to be familiar with the vasopressors, alpha and beta, and what effects they have, which each one of the following medications effects are. Epinephrine, you also need to be familiar with epinephrine infusions, drips, dopamine, dobutamine, Levophed, neosynephrine. You'd be quite familiar as to when you would want to use some of those pressors over others, depending on perhaps hemodynamic values that you're given, and which would be the best agent to use. Talking about hemodynamic values, we obviously need to know what the normal values are, and we really need to understand what each one of those values is telling us, especially how it relates to anatomy and physiology. When you think about where the catheter is placed, remember we always monitor through the distal port and obtain readings, and you really need to have a thorough understanding and the implications of what it is you're measuring and how that really relates, what valid or valuable piece of information that gives you, and helps you identify potentially what the underlying cause is, and then subsequently the best way to go about treating those patients are. You need to be able to identify the waveforms, looking at it at a monitor where you could see. It'll be a static thing, but you should be able to identify what perhaps a CVP line looks like versus a catheter, a swan catheter that's being advanced, where you're entering into the right ventricle versus in the pulmonary artery. Looking at all the things, understanding what the dichrotic notches are and what they tell you, what it actually is. Some of the nursing aspects of the hemodynamic monitoring, you need to be able to define and basically define what the phlebostatic axis is, or the phlebostatic point is. And then one other thing about, remember on the femoral axis, we talked about where the insertion site is. I use the acronym NAVAL to help you identify where you should try to cannulate the femoral vein. Cardiac, you need to be familiar with 12 lead and obviously 15 lead EKGs, and understanding the cardiac anatomy as it relates to the EKG, what vessels are involved, be able to understand what axis deviations are, and blocks. I'm not going to go into hemi blocks or anything real specific, but understand what blocks are and how you identify them. Cardiac output, how do you determine what the cardiac output is, and how you can try to create a cardiac output based on different values hemodynamic values that you get, what you can do to try to improve cardiac output. Understanding left versus right heart failure, signs and symptoms, and how you would treat it. identifying it also with the hemodynamic values. Understand the aortic aneurysms and different dissections, being able to type them and how we treat them, namely how we control the blood pressure. Obviously we don't treat them, we treat them with surgery, but we got to get them there to surgery. So what are our goals of treatment? With that, we need to be familiar with the medications, nitro, nipride, any of the chronotropic, gonotropic, and dromotropic type medications. One special note with nipride, it's a very specific considerations with administration, and also you really need to be familiar with the side effects and potential toxicology effects with nipride administration. Balloon pump, you need to have a basic understanding what the balloon pump is and how it achieves what it wants to achieve. Basically, you think about when the heart supplies itself with oxygen. You need to think about you need to understand how the balloon pump helps improve that in a basic working knowledge of it. Obviously, we're going to go into it in much more depth right before the exam, so it'll be a good review right beforehand. Look, I encourage you, everybody, to review the sample questions that are placed online. That gives you an idea. As always, I'm available for questions. You can always email or call me. I'll be happy to help you through any questions you might have. Otherwise, I will see you guys at 7 a.m. on Friday morning at the South Tower ICU training room on the second floor. If I get more detail with it, I'll be sure to email it out. Everybody, make sure that you have my number on Friday morning in case you're lost and you can't find us. That'll be the only way to get a hold of me. Again, my phone number is area code 254-913-9456. Thanks.